After explaining the tickle test to the patient, you are ready to begin the actual test at the first site. The simple object of the test is to find the weakest stimulus the patient can feel. This is done by first establishing the ion pathway so current flows, then finding a general range, then focusing in closer and closer to the setting that causes the nerve to fire. Dip the electrode into the saline, wetting the cotton swab and gold tip. Briefly touch the tip to a towel to absorb the excess water, to prevent a drip from running down the skin and distracting the patient. Hold the electrode steady with mild pressure against the skin. Anchor your hand or arm so the tip won't move. Ask the patient to close their eyes, focus on the site, and to say "now" when they first feel the slightest tickle. Wait 3 seconds in total silence to allow the patient to focus. Now turn the dial up the first time. Remember, the first time you turn up the dial, you are simply breaking the skin resistance and establishing an ion pathway through which the stimulus can flow. You are not making a measurement, so just turn up the dial until the patient feels the tickle and says "now." Then turn it right back down to 10, which keeps the ion pathway unbroken. The second time is a real measurement that establishes a general range. The next tests will close in on the exact setting that fires the nerve. Say to the patient, "This time it will feel much weaker, so really focus on the site and tell me when you feel the slightest tickle." Wait 3 seconds in silence. Turn the dial up a little slower this time, anticipating a lower setting where the patient responds. There is always a little overshooting of the dial setting because the patient needs a second or two to recognize the tickle and report he feels it. When the patient says "now," note the position of the dial. In this example, we will say he feels it at 26. Turn the dial back to 10, not to 0, which keeps the ion pathway unbroken. Give the instruction that you will again turn up the stimulus and wait 3 seconds to give him time to focus back on the site. On this test, you can turn the dial up fast to 6 points below the last measure. Hold for 2 seconds and quickly return the dial to 10. Without saying anything, quickly turn up the dial again to a setting 4 points below the first measurement. In our example, this is 22. And hold for 2 seconds, then return the dial to 10. Without saying anything, quickly turn up the dial again to a setting only 2 points below the first measurement at 24, and hold for 2 seconds. Following this procedure, you find either at this setting or the next, the original setting of 26, just as you are about to turn the dial back down, the patient says "now." This shows that it takes a second or two for the brain to process the signal and for the patient to respond. Again, quickly turn the dial back down to 10. Now use the potentiometer to find the exact amount of stimulus that causes the nerve to fire. You have not turned the dial to 0, and the electrode has not broken contact with the site. For our example, let's assume that the patient responded at 24. This setting is probably within a point, half the space between the dial marks, of the exact amplitude causing the nerve to fire and release a burst of voltage called an action potential. In this step, you will make a precise measurement using the potentiometer, which is a millivoltage meter. Voltage is synonymous with potential, so the potentiometer is a voltage measuring device. You have not lifted the electrode, and the dial is back down to 10. Give the instruction that you will again be turning the stimulus up. Wait 3 seconds, and quickly turn the dial back up to 2 points below the last time the patient said "now." Each dial mark is 2 points on the scale of 100, so this is only 1 mark on the dial below the last measurement. Next, watch the potentiometer while inching up the dial in 25 or 30% increments. In our example, that is between 22 and 24. Watch the potentiometer number. It fluctuates because the body is naturally producing a small amount of voltage all the time. But you will notice that as the dial slightly increases, the potentiometer number goes up a little. This is because turning the dial up puts more voltage into the patient's body. The potentiometer averages the voltage and displays this average every second, so the number appears to stutter. Watch closely, and at one of the settings there will be the slight increase, and then instantly another increase of an additional 20 millivolts or more. This jump is the voltage generated by the nerve fibers when they fire. Hold the dial at this setting, and in a second or two the patient will report feeling the sensation. If you have difficulty seeing this jump, try the reverse method. Once the patient reports the sensation during this incremental increase, ask the patient to report when the tickle stops. Wait 3 seconds, and turn the dial back by 25 or 30% increments, waiting a second or two at each setting. A drop of an extra 20 points or more on the potentiometer will be noticed when the nerve stops firing. In a second or two, the patient will report that he no longer feels the sensation. Now the test is complete. Zero the dial and lift the electrode. Record the dial setting that caused the nerve to fire, and record the numbers from the potentiometer. Record either the low and high. For example, at 140, it jumped to 180. Or record that the jump was 40 millivolts. You would then continue to test the site on the opposite side. Here it is again from the beginning, closer to real time. Explain the tickle test to the patient and instruct them to close their eyes, focus on the site, and to say now the instant they feel the tickle. Wait 3 seconds in silence. Begin by breaking the skin resistance to establish the ion pathway. Just turn up the dial until the patient says now, then turn it right back down to 10, keeping the ion pathway unbroken. Give the instruction that it will feel much weaker, then wait 3 seconds. Turn the dial up a little slower this time, anticipating a lower setting. When the patient says now, quickly note the dial setting and turn the dial back to 10. This is the first measurement. Give the instruction that you'll turn it up again and then wait 3 seconds. And quickly turn the dial up to a setting 6 points below the first measurement. Hold for 2 seconds and return the dial to 10. Without saying anything, quickly turn up the dial again to a setting only 4 points below the first measurement. Hold for 2 seconds and return the dial to 10. Without saying anything, quickly turn up the dial again to a setting only 2 points below the first measurement. Hold for 2 seconds. The patient says, now. Turn the dial back down to 10 and say, tell me again when you feel the tickle. Then wait 3 seconds. Now turn the dial back up to 2 points below where the patient last said now. Watch the potentiometer while inching up the dial in 25 or 30% increments, waiting a second or two at each step. Look for the potentiometer to jump an additional 20 millivolts after the slight increase when the dial increases. When this occurs, hold the dial at that setting, and in a second or two the patient will report feeling the sensation. Lift the electrode and zero the dial and record the numbers. Now we'll put it all together in real time. Begin by instructing the patient. This is a test we can perform on 5-year-old kids. They just laugh because all you feel is a very slight tickle. We call it the tickle test. The object is to find the weakest stimulus that you can feel. So it is a weak tickling feeling. You really have to pay close attention and say now the instant you feel the tickle. Okay? Let's start. Close your eyes, focus on the site, and say now the instant you feel the slightest tickle.
Now.
Very good. This time the tickle may be much weaker, so pay close attention. Say now the instant you feel the tickle.
Now.
Okay. Now tell me when you feel it again.
Now.
Okay. Once more, say now when you feel the slightest tickle.
Now.
Lift the electrode and zero the dial and record the numbers.
Now.
What if the patient says now when you're at 4 points or even 6 points
Now.
below the first measurement? Patients may be confused by feeling an after sensation, so return the dial to 10 and start again. Say, tell me again the instant you feel the slightest tickle, then wait 3 seconds. And turn up the dial to find the general setting where he feels the sensation.
Now.
Then proceed as shown before, turning the dial back to 10, up to 6 points below, and so on. What if you should inadvertently slip or lift the electrode or turn the dial to 0 during a test? Since you've broken the ion pathway, you must begin again at that site with the dial at 0 and the probe secured. Tell the patient again that they should say now the instant they feel the slightest tickle. Wait at least 3 seconds and turn up the dial until the patient says now.
Now.
Then turn the dial back to 10, re-establishing the ion pathway. Proceed from there as shown before. What if the patient responds just after waiting 2 seconds, or while the dial is being turned down?
Now.
Some patients may take longer to recognize the nerve firing. If the patient seems to be responding too late, try waiting longer, such as 6 seconds before turning the dial up or down.
Now.
What if I cannot zero in on a high reading? Some nerves may be so damaged that the patient cannot recognize the stimulus precisely. This is usually seen when the measure for the nerve to fire is 50 and above. Try waiting a few more seconds each time you turn up the dial, and waiting longer at each increment for the patient to respond.
Now.
You can also narrow in on the setting in 10-point increments first. For example, see if the patient responds at 40, then 50, then 60.
Now.
If they feel it at 60 and not 50, then use 5-point increments to narrow down the point between 50 and 60.
Now.
If the patient is totally inconsistent at reporting the sensation,
Now.
they are either not focusing or purposely trying to defeat the test. Patients can typically recognize the presence or absence of the stimulus within 2 points on the
Now.
dial, but most cannot recognize an increase or decrease in the stimulus within
Now.
8 points on the dial. So, on difficult patients, you can turn the dial up slowly from 10
Now.
and vary how long you wait between turns
Now.
until the patient responds at the same dial setting 3 or more times in a row.
Now.
It's up to you to repeat as many times as necessary until you are satisfied
Now.
with the reading.